Your kidneys may be in danger, and you don't even know it. Discover the 11 silent signs that could save your life before it's too late. Hello everyone, and welcome to another video from iHealth Talk 360, your health channel. Today, we're going to talk about the kidneys, their role, and the silent signs that indicate a problem. By the way, can you tell me in the comments if you know all the functions of the kidney? I know everyone will reply, it's a no-brainer. They act as filters and make urine, etc. However, this video will help you discover other functions you probably didn't know existed, as well as silent symptoms that may indicate danger. The kidney is a very discreet organ and doesn't like to express itself when it's in pain. However, medical progress has made it possible to identify hidden symptoms, which once discovered should alert you to the danger facing your kidneys. So it's important to be aware of them. That's why we're here today. I'll also explain when it's necessary to consult a doctor and get screened for kidney problems, even if you don't have any symptoms. At the end of the video, I'll introduce you to the enemies of the kidneys, i.e., the factors that damage them. You'll see that they're not the things you might normally think of. Let's take a look at the roles of the kidney. The kidney performs 5 different functions. The first is to filter the blood, i.e., to eliminate toxins and waste products. Do you know how many liters of blood our kidneys filter every day? 100, 150, or 200 liters. In fact, it is around 190 liters per day. Obviously, we don't have 190 liters of blood in our bodies, but the amount of blood that passes through the kidneys every day represents that amount. That's why it's important to have healthy kidneys so that they can continue to filter our blood. The second role is maintaining water balance in the body. The kidney acts as a regulator. It filters the water the body needs and eliminates the excess. This is why, when we are dehydrated, we urinate less. The kidney will say to itself, I mustn't eliminate too much water, I'm lacking it, so I'll keep some. Conversely, when we drink a lot of water, the kidneys eliminate it because they say, there's too much water in my body, so I'll eliminate some of it. The kidneys therefore play a role in regulating the amount of water in our bodies. The third role is maintaining mineral balance in our bodies. The kidneys help maintain the balance of several essential minerals, such as sodium, potassium, and phosphorus. A lack of sodium, for example, can cause neurological disorders that can lead to coma. An excess of potassium can cause heart rhythm disorders that can lead to death due to an imbalance in the heart rhythm. The role of the kidneys in maintaining mineral balance, sodium, potassium, phosphorus, is therefore essential. The fourth role is maintaining acid-base balance. If we consume foods that are too acidic, the body's pH becomes acidic. The kidneys, which have sensors, will then detect this excessive acidity. However, excess acidity in the body is not good for health, whether for the brain or for metabolism. The kidneys then eliminate the excess acidity. The goal is to maintain a neutral pH in the body. In the event of kidney dysfunction, the pH can become too acidic or too alkaline, causing many symptoms that we will discuss today. The fifth role of the kidney is to participate in the production of hormones and enzymes. The kidney produces a hormone called erythropoietin, EPO, which stimulates the production of red blood cells, thereby improving oxygenation. If the kidney is damaged, natural EPO production is compromised, which can lead to anemia. We will discuss all these symptoms after the video. The kidneys also produce renin, which is essential for maintaining blood pressure balance. In fact, some medications for high blood pressure act on this system. Finally, the kidneys produce calcitriol, an active form of vitamin D that promotes calcium absorption and, as a result, the proper functioning of bones and all organs that require calcium. So what are the symptoms that indicate that our kidneys are not functioning properly, i.e., that they are failing? Please note that these symptoms may also be signs of another disease. If you experience any of these symptoms, it is important to consult a doctor to determine the cause, rather than assuming that you necessarily have kidney failure. The first symptom is a change in urine color. I discussed this in a video titled 5 Urine Colors That Indicate Serious Health Issues. You can find this video on the right side of your screen or in the description. Urine may become darker and have a different odor. If the odor is different, it means that the kidneys are not functioning properly. The second symptom is a change in the frequency of urination. Either you urinate much less than before or much more, but in any case, not as usual, even though you haven't changed your drinking habits. One of the symptoms of kidney failure is urinating much less, even though you are drinking as usual. The third symptom, anemia. As you may have guessed, this is due to a lack of EPO, or erythropoietin. When someone has anemia, the doctor tries to identify the cause. Is it a lack of iron, vitamin B12, etc.? Kidney failure is one of the causes they look for. The fourth symptom is bone demineralization, meaning that the bones no longer have enough calcium, which makes them fragile. As you can see, this is related to the fact that the kidneys help maintain the balance of trace elements in our bodies and produce the active form of vitamin D, which is necessary for our intestines to absorb calcium. The fifth symptom, edema, i.e. swelling caused by the accumulation of water in our bodies. This edema is different from that seen in other diseases. In renal failure, it is mainly linked to the presence of albumin. Albumin attracts water and causes edema in our bodies. If, for example, we have edema in our legs, the doctor will check for albumin in the urine. They will check whether it is varicose veins, heart failure, or kidney failure, and prescribe the necessary tests. The sixth symptom is back pain, or, as they say, kidney pain, meaning pain in the lower back. These signs are also symptoms of pyelonephritis, an inflammation of the pelvis and kidney. In fact, pain in the lumbar region can indicate kidney disease, such as an infection, kidney stones, or a tumor. Kidney failure is not painful because the kidney is a very discreet and silent organ. It prefers not to bother us, even though it would like to alert us as soon as there is the slightest problem. The seventh symptom, skin itching linked to the accumulation of phosphorus in the body. As the kidneys are no longer able to eliminate it properly, phosphorus forms crystals which cause itching. This is also related to the fact that toxins are no longer being eliminated from the body very well, which also causes itching on the skin. The eighth symptom, nausea and vomiting, which are related to changes in acid-base balance. I mentioned earlier that the kidneys help maintain a neutral pH in the body. If this balance is disrupted, the kidneys and stomach will react. Information is then sent to the brain to tell it that there is too much acidity in the body and that it is unable to eliminate it properly, and therefore that it must stop taking in food. This can cause nausea and vomiting. It can also be a sign of a sodium deficiency, or in some cases, excess sodium. The ninth symptom is a change in breath, which becomes more unpleasant and different than usual. This is related to the fact that the body is loaded with ammonia, one of the toxins that is no longer eliminated very well and is also metabolized by the liver. If you are interested in the subject of the liver and detoxification, I invite you to watch the video I have already made on this topic. In any case, halitosis is one of the symptoms of kidney failure. The 10th symptom, neurological disorders, as I mentioned, include problems with concentration, alertness, drowsiness, minor tremors, etc., which are related to the fact that the sodium balance in the body is no longer correct, but also to the fact that toxins are not being eliminated and are preventing our neurological system from functioning properly. The 11th and final symptom is loss of appetite and the resulting weight loss. This is related to the fact that our body, which is no longer able to eliminate waste, no longer wants to take in more. I use the term waste to refer to food that will be converted into waste. As a result, we lose our appetite. When should screening be performed? You should consult your doctor, as there are various situations in which kidney screening is necessary. How is screening carried out? It involves a urine test and a blood test, which your doctor will prescribe if they believe you have symptoms or are at risk, even if you have no symptoms. Therefore, even if you have no symptoms, you should be screened at least once a year. In urine, they look specifically for protein, which is not good, and they check the creatinine level and creatinine clearance, which is simply the filtration rate of the kidney, through a blood test. Obesity, diabetes, high blood pressure, cardiovascular disease, whether hypertension or heart failure, autoimmune diseases, lupus, chronic inflammation in the body, rheumatoid arthritis, or if you have ever had urological diseases, kidney stones, repeated pyelonephritis, are risk factors. There are also people who work in environments containing toxic or chemical products that are difficult for the kidneys to eliminate and which, if ingested, can end up damaging them. And while we're on the subject, do you know what the worst enemies of our kidneys are? I'll give you the list. Generally, when asked what the enemy of the kidney is, many people think of protein, because people who do weight training consume more than average to build muscle. They say, "Oh dear, there's creatinine that isn't being eliminated." In reality, as long as you are healthy, your kidneys are functioning normally, and you are properly hydrated, protein is not a problem. It will only be a problem for people who already have kidney problems. People who already have kidney problems need to reduce their protein intake, because proteins are large molecules that the body cannot eliminate. But that's not what's most dangerous for the kidneys. The most dangerous are: 1. Dehydration. The kidneys need water to function properly and to eliminate excess sodium. 2. Excess sodium. Excess sodium causes an increase in blood pressure, which greatly affects kidney function. If blood pressure is slightly higher or much higher than normal, the kidneys eventually stop functioning properly. This is why people with high blood pressure are at greater risk of developing kidney failure. 3. Excess sugar. Sugar is the enemy of kidney cells. It is no coincidence that one of the main causes of kidney failure is diabetes. I will share videos with you about the harmful effects of excessive sugar consumption and how to stop consuming it. 4. A sedentary lifestyle, obesity and smoking are factors that hinder good blood circulation in the body. They are therefore the enemies of your beautiful kidneys. 5. Anti-inflammatory drugs, including those sold over the counter. These are very commonly used drugs, but they can be dangerous for the kidneys. For this reason, your doctor will usually prescribe anti-inflammatory drugs for a temporary period of 3 days, or for people who need to take them for chronic inflammatory diseases. These people need to have their kidney function monitored regularly and sometimes receive protective treatments for their kidneys. In any case, avoid taking anti-inflammatory drugs without consulting a doctor. For example, if you suffer from recurring pain in your shoulder, back or knees, or from headaches, and you have been taking anti-inflammatory drugs daily or several times a week for several months, talk to your doctor to find another solution and check that your kidneys are not damaged. I hope this video has enlightened you on the subject of kidneys. If you are interested in the topic, I will make more videos on it. I will also discuss colon cancer, prostate cancer, etc. Feel free to ask me in the comments if you would like me to talk about any of these topics. Don't forget to like and share this video with your loved ones to alert them to these symptoms. For my part, I am preparing many other videos on various topics. Take care and see you soon.